For the lucky, access to healthcare is a given. But it does appear that the plan where everybody gets to have access to affordable, quality health services is yet to emerge. So how do we bridge the gap between the haves and the have-nots? And is the NHI really the answer? Let's get started. Good evening and welcome to the Democracy Gauge. I'm Bongani Bingwa. Now, since the dawn of democracy, South Africa has made remarkable progress in trying to improve the lives of citizens. Health has certainly been among the major priorities government has focused on in terms of addressing inequality. Now, in this country, private and public health systems do exist in parallel next to each other. The public system serves the vast majority of the population, but is chronically underfunded and understaffed, excuse the pun. And those who can afford it and who have medical aids generally use the private system, and they are far better served most of the time. Now, the NHI is a proposed financing system that is meant to ensure that all citizens are provided with essential healthcare. Whether or not it will work, and certainly how it will do so, remains an unanswered question. So our poll tonight, we're asking, can we democratize the health industry? You choose from our three colors: green for yes, yellow maybe, red is no. And of course, send us a WhatsApp video to 065-862-4548. Our poll is on our website, sabcnews.com. The conversation is also on Facebook and Twitter. Remember to use our hashtags SABCDG25 and SABC News. Now, according to a report released by Stats SA in 2017, over 70% of South Africans rely on public hospitals for healthcare, and only 17% report to be members of accredited medical aid providers.
Promising improved health, both private and public hospitals have one goal in mind: to see patients get better. With public hospitals offering free services, the demand for care is great amongst disadvantaged citizens. Nosipiwe Nduna from Port Elizabeth is just one of the many residents who visits a public clinic at least once a month. Nduna is on a lifelong treatment of antiretrovirals. To collect her medication takes her an entire day.
Sometimes you do not even go to work, even though you thought you would make it for work. But you end up waiting the whole day. Sometimes nurses must run to a meeting while we sit and wait.
In the same city, Andisiwe Qana has a far better experience. Qana has been on medical aid all her life and does not recall ever feeling stranded while seeking health care. She shares a recent incident which she says made her realize how privileged she has been.
I had to go to hospital around about 2 o'clock in the morning. I had shivers, I was feeling hot, cold, I had pains, I had a headache. And because of the availability of a medical aid, I could be immediately attended to. I just took my card, went to a nearby hospital, private hospital.
Even to healthcare providers, this gap is visible.
The primary health care is the same wherever you go, and anybody, whether poor or rich, they can get it. And on the other end, which is the quaternary services, when I talk about the quaternary service, I'm talking something like your renal transplant is done at government institutions, so everybody can access it. But in between, you've got a very serious problem where those who don't have money are suffering, and those who have money, they're getting a good healthcare system. And it's something that needs to be corrected.
The public healthcare system in the country continues to be heavily constrained. But through the National Health Insurance Fund, a complete overhaul is anticipated, taking the country a step closer to an equal healthcare system for all. Anda Ngonji, SABC News, Port Elizabeth.
All right, so tonight we're talking about how to democratize healthcare in our country. And in studio, I'm joined by Nkululeko Tonto, who's an attorney in the health team with NGO Section 27. Welcome to the Democracy Gauge. Thank you so much for joining us this evening. I mean, In a sense, Ngululeko, the very fact that what you do has become necessary is an indication that we haven't quite achieved everything we would like to have.
Yes, I think so. The work that we do seeks to influence and develop the use of law to promote and advance human rights. And we get our name from Section 27 of the Constitution. You would think that by now we wouldn't have much work to do, but it still continues.
So what are the major challenges? Where has the system failed? Because as I said in my introduction, the government will have all of us believe they're doing their best, it's all hands on deck, but we know there are chronic failures throughout the system. Where have you identified those to be?
There are a few. One of the big hurdles that we are facing at the moment is shortage in staff, which you've alluded to. So there's underfunding for staffing and for facilities, for maintenance of facilities, and provision of, which allows for the provision of services. Those, I'll say, are the two key components, and those are also further eroded by other factors such as corruption, poor management, and poor planning in certain instances.
Talk to me about some of the litigation you've been involved in.
At the moment, we aren't involved in any litigation that I'm aware of. We have written and engaged with the department on various issues, one of which is the emergency medical services, and we've come close to litigation on some issues in more recent times, but at the moment we're not litigating.
So there is a sense that you as a civil society organization are having your voice heard?
Yes, there is, and we have partnered with various organizations, one of whom I think most famously is the Treatment Action Campaign. But we do on an ongoing basis engage and ask questions of the department, and of course engage with people who are healthcare users.
So it's a long way then from the period where there was intense antagonism between organizations such as yourself and the government. I'm thinking particularly, of course, around making medicines for HIV treatment available.
Yes, no, we've definitely improved from that stage of our relationship.
All right. So ultimately, we want to see a situation where most South Africans, or in fact all South Africans, have relatively equal access to quality health care. The government, and particularly the Minister of Health, are very keen on the idea of a national health insurance. Trouble is, we don't quite know what the beast will look like. The devil is in details we don't know.
That's precisely our view as well, and we've communicated as such to the department. So we are very much in favor of universal healthcare. Our concern is that the proposals in NHI will not achieve that in the form that they're in right now.
So what's proposed and where might it fail, as briefly as you can?
Okay, so the funding model requires basically more infrastructure and more people to staff it. So the contracting models will require people to consistently work on them. We already have a shortage with human resources in health.
But isn't the thinking that we'll take funding, we'll take resources, human and of course financial, from the private sector that services so few people and try and spread the pie around? Isn't that the thinking?
That is the thinking, but you'll need to constantly engage and monitor this new system that you're creating. So you'll be contracting with district and local healthcare providers. So it's not just one stream, and you've got to manage these different areas. So in different districts, you've got to have a unit that will contract with the various providers.
So if not NHI, what else? What then?
We don't have a counter proposal to NHI. We're in agreement with universal healthcare, and what we've asked is that we think a bit more about how it should be structured and how it will look like. So the funding model can be adjusted, and there have been some suggestions that have been made by both us and others.
In the meantime, we continue in some areas, in some instances, you could say, to score own goals. We've seen scenarios, for example, where there's been industrial action or labor action at hospitals, where even, of course, healthcare providers are not able to perform their duties. There's interference at times with that. We've seen cases of negligence. We know, for example, the Gauteng Health Department is practically broke because it's so much in litigation in terms of medical negligence, those sort of things which are preventable, one could argue. How can we fix those scenarios?
So that, without changing the system as it stands, what we need to have is more attention to the staffing component and facilities. The reason why I'll just look at those two is when you have more and better trained staff and you've got a fuller complement of people who are able to service healthcare users, you already start devoting more time and attention to the issues and to preventing the issues before they arise. The other one is with your facilities. So there are lots of poorly maintained facilities. So instead of just building new ones, we must work on the facilities we have and improving those so that allows for actual access. So you don't just have a structure, but you've got a structure that people can use and get services from.
There is also the idea, though, that the private health sector is amazing, that if you're on medical aid, your life is sorted out. Not always the case, is it?
No, unfortunately not.
So where are the shortfalls there?
The big issue with the private healthcare, as you've pointed out, is that there's capacity, but it's incredibly expensive. And for people on medical aid, you'd also think that all your problems would be solved. There's a big problem with the benefit design at the moment. Certain procedures or investigations are covered when you're admitted in hospital, but not when you're just doing it
out of hospital plan, right?
Yes. And that has been identified as something that increases the cost of healthcare by quite a few times, probably between 7 and 10-fold. And so that is a big stumbling block. That's for people on medical aid. If you don't have medical aid, not only would you have to pay a deposit to go to a hospital, but you've got to pay all of these costs. There's been no proper expression of how that'll be reduced from the players in the private healthcare.
So basically, from everything that you've told me, I'm going to ask you to nail your colours to the mast. We're asking the question this evening, can we democratize our healthcare industry? Red is no, yellow is maybe, green is yes. Pick one up. Which one?
Can I play it safe?
Even though you've told us basically there's no plan on the table.
There is no plan on the table, but with working together and actually trying to look at all the reports and the commissions that have been commissioned. So
hopefully one day we'll get there.
Yeah, so there's all this material out there. We just need to get together and use it and then look at it collectively in order to solve the problem.
All right, Guleko, thank you very much for your time this evening. Now, a reminder of our poll question: can we democratize the health industry in South Africa? As I said, green is yes, yellow is maybe, red is no. Send us your WhatsApp videos, 065-862-4548. We'll share some of your thoughts after the break.
We do not just speak, we let every voice in our nation find full expression in language and in culture. We do not just teach, we empower all people with education. We do not just bring you the news, we place you where the news is happening. We do not just entertain, we take you on journeys. We do not just broadcast sport, we create an arena for sporting heroes to inspire you. Ours is not just a job, it's a calling to ensure that everyone in our nation is informed, educated, and entertained. We're able to do this because you do your part. SABC TV licenses, it's all made possible by you.
This week on Health Talk.
People over the world travel for a variety of reasons, including holiday, business, and nowadays to seek medical treatment in other countries. Now, when traveling for leisure or business, do you ever think about your health when planning your trip?
When you reach the border, if you can have a passport, but without a yellow fever, you can't cross the country. They'll say you have to go back.
That's the most important one. If you go to any area where there's a potential risk of malaria.
I didn't take any vaccination, but last time when I was in Kenya, I did have the yellow fever vaccination.
Every Saturday at 9 a.m.
On Trains Travel, we bring you a full guide on all things lifestyle related. With so much to discover,
We give you comprehensive reviews of places to visit, music, travel, and food. We also explore the arts, whether on or off stage. All this and more. Be sure to tune into Trends Travel Saturdays at 5:30 p.m.
We do not just speak. We let every voice in our nation find full expression in language and in culture. We do not just teach. We empower all people with education. We do not just bring you the news. We place you where the news is happening. We do not just entertain. We take you on journeys. We do not just broadcast sport. We create an arena for sporting heroes to inspire you. Ours is not just a job, it's a calling to ensure that everyone in our nation is informed, educated, and entertained. We're able to do this because you do your part. SABC TV licenses. It's all made possible by you.
Right, being interactive is the name of the game here on the Democracy Gauge. Let's go to social media and have a sense of what people have been saying. We'll take Facebook for today. Some lengthy comments there. The first one from Albert. Good evening, Mr. Bingwa. Yes, as South Africans, we can see with our naked eyes that the Department of Health is relapsing. Each and every patient should get better services according to Batupili principles. But when we enter the hospitals, we find nurses and doctors walking around with their heels without taking care of the patient. That's what Albert says there. So it's all about patient care, I think, for him. Another one says more accessible. Of course, previously it was less accessible, but it's fair to say more persons have some medical attention on call. But the medical question demands for a quality aspect to accompany the answer. Often where the majority are, quality slumps, and when that happens, bidding starts, and soon the highest bidders receive the best services. Then there emerges two parallel services differentiated by quality. I mean, I think that's the gist of what that one is saying. These parallel systems, and you get better service clearly when you've got more money. Hans says, how can it be democratized when the country has been communitized for 25 years? I'm not sure what you mean there, Hans, but I suppose that the idea of spreading the pie around is exactly what we're trying to get at here. All right, so that's the picture on social media. We encourage you, of course, to participate in the show. Often we ask you to send us WhatsApp videos, but that's not the only way you can be with us. Well, of course, the People's View allows you to interact with the show and share your views candidly. As I say, often we take your WhatsApp voice notes and videos, but today we're speaking to Tebogo Tlhopane, who joins us now via Facebook Messenger. So that's also an option. Tebogo, a very good evening to you. Thank you for joining us. The question before us is, can we democratize healthcare in South Africa? Can we make it available for as many people as possible? What's your view?
First of all, good evening, Bongani, and to your viewers. Look, we believe that it can be done. I think from us coming from a medicinal cannabis space, and I'm talking about the CBD part of the cannabis, we think that if we can incorporate that within the health sector, we'll most likely definitely reduce a lot of the costs associated with health, and also reduce a lot of the fee that you'd find that people going to hospital, because cannabis can be used a lot as a preventative. So if we can incorporate that in our health system, I think it's going to relieve a lot of the stresses that the country is suffering from at the moment.
Of course, I imagine that conversation then brings into, all kinds of other issues that we need to think about. If you think about natural remedies, if you think about traditional medicines being part of the ecosystem, do you think that we're making enough headway in terms of being able to be inclusive of all aspects of medicines, not just Western-based medicines?
Look, my opinion, I think the government dropped the ball. I think when they started 1994, they had put a communique and they set up a structure for inyanga, as we call them, or sangomas, to be part and parcel of a value offering when it comes to health. And they dropped the ball because up until now, nothing has happened. And I think that's the reason why we've taken this as an initiative ourselves to say, let's incorporate, traditional medicine. Chinese have been doing it. TCM, traditional Chinese medicine, they've been there for years. And, we've got medicines here that we've been using when we grew up. Bolingala, for example. I mean, you used to take that when you had flu, and you could actually get rid of it. So a lot of those things we've lost. And I think if you incorporate that, including medicinal cannabis, into the mix, we have ourselves a winning formula.
Well, I suppose there's a big discussion to still be had. Debucho, thank you very much for being part of the show this evening. There's a big discussion to be had about standardizing all those approaches, and perhaps that's why there's some reluctance to spread it all so quickly. Now, if you want to be part of the People's View in our next program, simply send us a WhatsApp video to 065-862-4548. You can also engage, as you've seen with us on Facebook Messenger, live on the show. At the end of this episode, I'll throw forward to tomorrow's topic. Now, Obed Nchehang from the Northwest. Your story is coming up after the break.
Every year, more and more people all around the country are saving money on their car insurance. Let's meet some of them.
Tell me how you feel about being in one of these insurance ads that you've seen on TV.
It's exciting. The husband is a bit jealous.
When you did make that call, what was the experience like?
They listened to you and they helped you save.
How much did you end up saving?
Almost 500 Rand a month. With the savings, we can do more things as a family. Switch and save.
Yes! When?
Now.
Right now?
Yes.
Tell them.
It's your time, it's your time, it's your time, it's your time.
If you think it's a hassle getting a quote, put us to the test. Call or SMS now for a quick quote and make 2019 your time to save. SMS SAVE to 34473.
So how did you hear about insurance?
So it was a TV ad. Normal day-to-day people hearing their testimonials and hearing how much insurance saved them. You want to put up your hand and say, that's me. I want to save money. Often you see these ads and you think, okay, well, they've been told what to say, but it's not. And you ask the question.
You're not a professional actor?
No.
How much did you end up saving?
300 Rand. Cha-cha.
If you've been with the same insurer for years and haven't recently put insurance to the test, call or SMS now and make 2019 your time to save. SMS SAVE to 34473.
So how did your path cross with insurance?
My nephew referred me because he had just switched and saved.
Yeah. How much did you save?
Over 900 Rand.
What are you doing with your saving every month?
I want to go to the Caribbean island. I want to go and get my groove back.
You need to give your nephew a shout out. Give him a shout out, Juanita.
Dale, you are awesome.
And now, she and Mr. Quipman are going to get their groove back.
They've all saved. Why shouldn't you? SMS SAVE to 34473 and make 2019 your time to save.
So what happened is I made the phone call and I asked Kolisa to just call me back. He explained everything to me, a meaningful conversation.
How much did you actually end up saving?
Almost 750 rands. That's how I switched and saved. But I'm glad our paths crossed.
We could make an insurance connection here. Have you and Kolisa gone out on a date or something?
No, it was just insurance.
Oh, is it your time?
Yeah, it's my time.
Just think what you could do with the money you save. SMS SAVE to 34473. 2019, it's your time to save.
Made a call, so what did I have to lose, right? I had the nicest conversation with Naz. He ended up saving me over 1,000 Rand.
What?
Yeah.
How long were you then with your previous insurer?
Around 2009.
Nearly a decade.
Yeah.
It's a lot of money there
Yep.
that you could have saved, right?
almost-
Let's focus on the future. If you were to give somebody advice about starting off the new year,
Make 2019 yours. Have a 2019.
SMS SAVE to 34473 and make 2019 your time to save.
We've now come to one of my favorite parts of the show where we profile ordinary South Africans and tell their stories. You can find all of that on our website every day, of course. We go there to show you exactly what South Africans have experienced. Today we are in Mahikeng, where we tell the story of Obed Ntehang, who's a 64-year-old retired teacher who says although he is retired, he continues to have a love for sports and particularly community development.
My name is Obed Ntehang. I'm 64 years old. I'm a retired teacher. I was born here in Ramokokastad. I'm a retired teacher, but I haven't left sports yet. I'm still running a team, Batlasi Athletics Club, which competes in track events and cross country.
Stand up. Then pump yourself 5 times.
I have 2 kids who are now in who attend tech sports. There is nothing that I benefit from the government. I expected the government.
So that's the story there of Obed reflecting on his contribution to community development. Now, as always, before we say goodbye, here are the results of today's poll. We thank you for taking the time to watch and participate. There it is on your screen. Tomorrow, we are focusing on Freedom Day, and we're asking, is South Africa truly free? That means our poll is open. You can vote and send us your WhatsApp videos if you want to be part of the show. So for tonight, from Fortune, myself and the rest of the team, ubusuku benzolo. Good night.
This week